A new report has revealed that casualties among civilians in Yemen has reduced by half during the truce period last year. The following report has more.
During Yemen's 6-month ceasefire in 2022, civilian deaths and injuries decreased by 54%, but the number of people displaced over the 8 years of the conflict has risen to over 2 million, according to the International Organization for Migration. The IOM's displacement tracking matrix estimated that around 2,302,000 people are currently internally displaced in Yemen, with Maghreb Governorate witnessing the highest rates of movement in 2022. While the UN-mediated truce between the Houthi rebels and the internationally recognized Yemeni government did alleviate suffering and displacement compared to previous years, however, the IOM said that the humanitarian needs are higher than ever in the war-torn country due to conflict and extreme weather conditions such as flooding. According to the International Organization for Migration, although there were no large-scale escalations following the truce in 2022, humanitarian needs continued to worsen across the country. Gaps in the humanitarian response persist, especially in the provision of vital health services, protection support, shelter, and other non-food item assistance. In 2022, around 60,800 people were displaced in the south of the country, a considerable drop from the 157,500 displaced the previous year. However, only 94 of the 195 hosting sites for displaced people are supported by external partners, raising concerns over emergency prevention and response measures. 8 years have passed since the outbreak of armed conflict in Yemen, when the Houthi rebels took control of the capital Sana'a in September 2014 and sparked military intervention by a Saudi-led coalition 6 months later. The war has created one of the world's worst humanitarian crises, with millions suffering from food insecurity, lack of adequate housing, and the spread of diseases.